Good day, I'm Elrosie Santiago, a student nurse from BSN Susie. I'm here to demonstrate the Leopolds Manuever Fundic height measurement and fetal heart auscultation. So let me tell you what you need to assess first. The first one is to determine the need for a Leopolds Manuever. Rationale, this procedure is probably performed after 24 weeks gestation when fetal outline can be palpated already. Second, is assess the client's overall condition and determine when was the client last voided or was last tested for urine analysis. Rationale, the procedure includes palpating the stomach that may trigger the client's need to void. We also need to determine the immunization history. Rationale, to check if the pregnant woman is safe or tetanus toxic. If there is a history of abnormal fetal presentation in the family during pregnancy. Rationale, to know what to expect. The last menstrual period and expected date of confinement. Rationale, baseline data to make sure that the measurement is correct. Next is planning. We need to allow adequate time to prepare for the procedure, and the procedure must be performed during an antenatal checkup. Mentioned in the procedure are stethoscope, measuring tape, draw sheet or top sheet, antibacterial hand spray. After making sure that all the equipment needed are already prepared, then it's time for implementation. Before proceeding to the procedure, we need to make sure if we are about to do the right procedure needed, so check the position order to verify it. Now that we are verified it, we can now start. Introduce yourself and verify the client's identity using the agency protocol, and explain to the client what you are going to do, why you keep concerned, and how they can cooperate. Good day, ma'am. I'm Elrosie Santiago, a student nurse from the Leopolds University of Science and Technology. Are you Mrs. Chantialisa S. Pasqua? Oh, okay, thank you. Apply for client privacy by drawing the curtains near her and ask the client to empty the bladder before the procedure. Rationale, the procedure includes palpating the stomach that may trigger the client's need to void. Perform hand hygiene and observe for other appropriate infection control procedures. Obtaining Fundic height. Position the client in a dorsal recumbent position. Then place a pillow under the head for comfort. Place a rolled small towel or pillow under the client's right hip. Ask the client to be still with arms on the side. Grip the client with the draw sheet exposed from below the breast and the symphysis pubis. Inspect the client if she has scars, diastasis recti, hernia, linea nigra, regular gradivum, contour of the abdomen, state of the umbilicus and skin condition. Determine the fundal height using the ulnar side of the palm. Measure the fundal height using the measuring tape. Place the line 0 to the tape of the superior border of the symphysis pubis. Stretch the tape across the abdomen's contour to the top of the fundus along the midline. So, let's move on to the Leopolds Manuever. Instruct the client to relax the abdominal muscle by bending the knee slightly and do relaxation breathing. Reinforce the explanation given earlier. Use the flat palmar surface on the finger, not fingertips, during palpation, and keep fingers off hands together, and smooth and gentle deep pressure if necessary. First maneuver is stand the client side and face the client. Palpate the fundus using both hands. Second maneuver, place your hand on the inner side of the client's abdomen about midway between the symphysis pubis and the fundus. Purpose to identify and locate the fetal back. Fetal back smooth hard, knees and elbows with a number of angular modulation. In maneuver, continue facing the client, thus the lower abdomen portion. After knowing the position of the fetus, we're now at last procedure, which is auscultating the fetal heart rate. Make sure that you have your stethoscope with you before proceeding. Place the bell side of the stethoscope chest piece on the fetus convex portion, closest to the anterior uterine wall. Listen by pressing it firmly and very gentle. Count on a full time holding the stethoscope chest piece while the other hand fills the client's radial parts. Now that all procedures are done, fix the client and say thanks to her. We are all doing all the procedures needed. Thank you, Mom and Sir, for cooperating. Evaluation and documentation. Document the procedure including the test performed. The result, the client record using forms or checklists supplemented by narrative notes when appropriate. Notify the healthcare facility responsible regarding the results. Inform the client regarding the findings. Form a detailed follow-up based on finding that deviated from expected or normal for the client. And lastly, teach the client how to do proper follow-up and provide other appropriate instructions. Thank you for watching.